Welcome back to Thanks for joining me. In the last episode on the population health cycle, we discussed the sell step and how important it is to consider this step as a sale and use various tools like behavioral economics. In this episode, we're going to discuss step 5 of the population health cycle, solve. So we've now been through the select, survey, segment, and sell steps of the population health cycle. Now it gets down to the nitty-gritty of solve. Through these steps, we should have gotten people involved and know what they have as barriers to care, gaps in care, their risks, and how to work with them. Solve is where your population health management or care management team really gets to work. You will use the data to drive the decision making and be sure to head upstream in an effort to prevent issues from occurring. Some key areas to focus on include getting those gaps in care done by helping them to arrange appointments and coordinate their care, helping them with issues around transportation, housing, food and diet, etc., educating them as to their condition, how they can better live with it, what they should be doing, and motivating them to help them do just that. Being available 24/7 is critical. At Specialty Disease Management Services, we used a very intensive model, as I had mentioned in prior episodes, of community-based staff, which was typically a registered nurse and a community resource coordinator or CHW. They were assigned a specific caseload. Depending upon the program, that could range from 1 to 60 per team to about 1 to 125. Obviously, there are other conditions that we did not work with or programs that may require even more intensive staffing. I often see high ratios of patients to staff. In fact, I once spoke with an ACO that was setting up a diabetes management program. They had identified thousands of persons with diabetes. I asked them, "How are you going to staff this?" They replied, "We have hired one RN." Now, anyone who expects one RN to be able to move a population of thousands of individuals with a chronic disease is essentially asking for no results. Another instance was during a consultation with a Medicaid health plan that had lost about $100 million in the prior year. We were beginning to discuss where their issues were and what they saw as areas they needed to work on. It was clear that costs for persons living with chronic diseases were very high, so I asked, what was the staffing ratio in your disease management program? The chief medical officer chimed in, "Honestly, I'm 35 nurses short in order to make a difference. I just can't get the staffing budgeted. Understaffing is the number one issue I see that causes the solve stage to solve nothing. Remember, digital may scale the sale, but it's relationships that keep the peeps." Speaking of relationships, that's why we used a primary nurse model. Each nurse in their CRC had a specific caseload and worked with those patients. They were the primary point of contact. They grew to know each other. It was about trust, knowledge, etc. Many systems have a different model in which whoever is available that day or takes the call is the person who works with that patient. I firmly believe that the establishment of a relationship between the care manager or a small care management team and the individual is another reason for our success. A third thing we did was flexibility. Many programs are highly structured. For example, the low risk level gets a mailer and one call per quarter. Those in the moderate risk category get a mailer and two calls per quarter, and so on. We gave our staff the flexibility to manage by providing some minimum requirements which they could go above and often did. It was their population to effectively manage and maximize overall results. If they needed to talk with someone a few times a week, they did. Home visits, for sure, it's a great way to connect and get more insights into their life. So these are just a few ideas and examples for the solve step. There's a lot more where these came from. If you'd like more information about the solve step, assistance with developing a segmentation system or your population health program, or you're looking for a speaker, contact us at info@accountablehealthllc.com or reach out to me directly on LinkedIn, and please provide your comments and thoughts below. Thanks for watching and look for the next episode of the Population Health Cycle. Score!